let me start with you, Mr. Gottlieb, Dr. Gottlieb, I should say, because we've been talking to you now for the past several weeks. But this weekend, it feels like this whole situation, both in the United States and also, obviously, in Italy, has moved to a new place. This is a new chapter here.
Yeah, I think we've reached a predictable tipping point where there's going to be a rapid acceleration in cases here in the United States. We still have a narrow window of opportunity to implement tough mitigation steps that could prevent a very large epidemic in the United States, but we're losing time, and we need to start taking more aggressive steps right now to try to contain the large outbreaks that are in probably multiple U.S. cities right now to prevent a broader epidemic and try to get to a point where we don't exhaust the healthcare system. The goal is to try to make sure that the peak of this epidemic, and we are headed for an epidemic here in the United States, doesn't become so large that you get to a point where you've exhausted the healthcare system. And that's what happened in Wuhan, China. When they exhausted their healthcare system, that's when you saw a rapid acceleration in the fatality rate in that region.
So what does that look like, though, just so we understand?
What it looks like is widespread school closures in areas of outbreak, closing businesses, closing places where people gather indoors like movie theaters, shutting down large events, asking businesses to have workers telework. But you also have to step in with assistance, not only to assist the localities and the states with money from the federal government, but also people who are going to face significant hardships from these measures. We should do this up front as an inducement to get localities and states to take these tough actions. We're going to end up with a massive fiscal package, a bailout on the back end of this. We are better off using that money up front to help buy some of the actions that we need to mitigate this epidemic rather than spending that money on the back end after we've had a very large epidemic. We'd be better off spending that money now to induce the kind of actions we need to see.
Scott, where are we talking about? Areas that are affected, obviously, that would be Kirkland, Washington, but are you talking about Westchester, New York at this point? There's many outbreaks all over the place.
Yeah, it's broader than that. I mean, there is the potential that if we don't take tough measures right now, we could be looking at tens of thousands of cases in the United States. That's not unrealistic. If you look at the number of cases in Italy and Singapore, and you apply that over our population, you're looking at tens of thousands of cases in the United States. We have multiple areas that are dense population centers where you could see widespread transmission.
So should we be going to school and work in places like New York City and Westchester and other, just very broadly, should these things have already taken place here or no?
Well, the good news is businesses are implementing mitigation steps. I mean, the private sector really has been leading here, trying to engage in social distancing and reduce the opportunities for rates of transmission. It looks like there's a large outbreak in Santa Clara, California, Seattle. New York might have a large outbreak. There's going to be outbreaks in multiple U.S. cities simultaneously. That's why we're well past the point of containment in the United States. And large quarantines and lockdowns like what they did in Italy and China won't work here. We're well past that point because we now have this seated in multiple U.S. cities.
It won't work here. Okay. Dr. Scott Gottlieb, hold on for a second. We want to get to Dr. Borio in just a moment, but I know that Meg Terrell has a question that she wants to jump in with. Meg?
Oh, Andrew, thank you. And Dr. Borio, it's a question for you. I'm just wondering how you would assess the testing capacity in the U.S. right now. We are seeing commercial companies now coming online. How are we doing? How would you assess the messaging from the government on that? And where do you expect us to be by the end of this week?
Well, so the good news is that today I believe the commercial developers, the big ones, are coming online and the capacity is going to increase significantly. The bad news, or the good news, is that we're going to be able to find a lot more cases that we know have been circulating in America. And we're going to see how steep this epidemic curve is going to get. We are just what we can to enhance social distancing. Now, the degree with which we implement those measures may vary from locality to locality based on the number of cases. And the way I see this is a lot more like a shutdown, a partial shutdown, but not a lockdown. We should not be talking about lockdowns in America.
Do you think what happened in Italy was the right decision or wrong decision?
Again, the way I see this here is that we need to, the goal is to have social distancing. Lockdowns would not do anything to enhance social distancing for the population that is under lockdown. So the goal is to apply our technologies, apply the innovative systems we have. The business have been very proactive in that to improve social, and individuals have a role to play too. It's very important. Everybody has a role to play. Individuals, it takes some responsibility to make sure that they do not go to work if they're sick and to stay out. And avoid crowded places, travel, cruises, etc.
Dr. Gottlieb, you're in Washington right now. You live in the tri-state area. How are you planning to get back?
I'm going to fly back. And look, but I'm taking precautions. We will get through this. And we're going to look back on this one day and say that was bad, but we will get through this.
When you say you're taking precautions, what does that mean?
Well, look, I'm being very vigilant about touching surfaces. I think a good portion of the spread here probably is through surfaces and not just respiratory droplets. I'm not taking past things on an airplane. I'm not taking things from the stewardess like cups and glasses and food. So I'm being conscious of my personal hygiene. I'm the last to board. So I'm doing things to try to avoid contact and engage in social distancing. And these behaviors practiced on a mass scale are going to have a significant impact on transmission here and help reduce the rate of transmission. But it needs to be led by the public sector as well as the private sector.
What
We will
about
get through this.
offices where people share computers and desks?
I think things should be clean. We're going to start implementing heightened requirements for hygiene in offices and workplaces and also deep cleaning. And some of this is going to last. Some of this won't go away. Just like after 9/11, security was put in place, but some of it never went away. Some of the steps that we take now will be in place for a long time, and that's probably a good thing. We're going to maybe have reduced flu seasons because people are going to be more vigilant about hygiene in workplaces and other gathering places. You know, the one thing I will say that's very interesting, I flew this weekend. The airlines have done nothing to step up practices on the airplane. A stewardess was not wearing gloves. They weren't passing out personal hygiene products like Purell. You know, if the airlines are worried about reduced volumes and want to inspire confidence in travelers, they should be stepping up the measures, guaranteeing that they're doing deep cleaning on airplanes and not requiring
There's
passengers
no way
to
they
wipe
can do
down.
deep cleaning when you turn around a flight that quickly. I mean, you watch how quickly they turn those things.
Maybe they have to add more time so that they can wipe down seats better. But if they would step forward and tell the public that they're doing that, maybe the public would feel more confident about getting on airplanes right now. After 9/11, they stepped up security, and that helped inspire some confidence to get back on the airlines. They've done nothing, absolutely nothing that I've seen that was visible to me.
Do you think that people broadly should travel?
I don't think we're at the point where people should shut down their travel right now, and I don't think we should ever get to the point where we cordon off parts of this country and prevent people from traveling. I do think people need to be more aware of being in crowded environments. And on an airplane, it's not the air quality that worries me. I don't think this spreads easily through the air on an airplane. I think it's more of the touching of the surfaces and the unclean surfaces and passing things back and forth between passengers, which Starbucks did to stop refilling cups that people bring in for their own coffee, the barrister. That's brilliant, because what would happen is someone would bring in their dirty cup if they maybe had coronavirus, give it to the barrister would touch the cup and then touch the next 30 cups. If all businesses thought about steps like that, simple things that they can do to reduce transmission, we could really have an impact on this. But we need leadership. We need to be talking about these things in a systematic fashion. We also need a systematic approach to when localities close schools, close businesses, cancel large events. We need to be all working off the same kind of playbook.